I'm comparing my MAR to my orders, Janet Green and Janet Green. That is correct. We're going to give gentamicin 80 milligrams, IV Piggyback every 8 hours, gentamicin 80 milligrams, IV Piggyback every 8 hours. Checking for allergies, no allergies. Okay, everything's correct. I'm going to check my medication to my MAR. Gentamicin 80 milligrams diluted in 50 milliliters of normal saline, and it's correct. Check my expiration date, and it's not expired. Now, I'm going to check for safety. Safe dose, 3 milligrams per kilogram of body weight for 24 hours, divided into 3 doses, up to 5 milligrams per kilogram 24 hours, may be given as indicated. So it's a safe dose. Dilution, 10 to 40 milligrams per milliliter, further diluted each single dose in 50 to 200 milliliters of normal saline or D5W, given over 30 to 60 minutes. Precautions, use extreme caution if therapy is required over 7 to 10 days. Advanced age and dehydration may increase the risk of toxicity. Use extreme caution in patients with end-stage renal disease. Risk of neurotoxicity is increased in patients with pre-existing renal damage or normal renal function with prolonged use. Partial or total irreversible deafness may continue to develop after gentamicin is discontinued. Normal range between toxicity and therapeutic levels. Periodically monitor peak and trough concentrations. Therapeutic level is between 4 and 8 micrograms per milliliter. Monitor frequently in patients with impaired renal function. Watch for decrease in urine output and rise in BUN and SCR. Closely monitor renal eighth cranial nerve function, especially in patients with known or suspected reduced renal function at onset of therapy. In patients who develop signs and symptoms of renal dysfunction during therapy. Monitor urine or decreased specific gravity, increased protein, and presence of cells or class. Maintain good hydration. Monitor serum calcium, magnesium, sodium, potassium levels may decline. Now I'm going to check compatibility. This is 5% dextrose and gentamicin, and it is compatible. Now, I'm going to wash my hands and gather my supplies. I'm going to check my medication again. Gentamicin, 80 milligrams, and 50 milliliters of normal saline. So this is correct. I'm going to label my medication. Gentamicin, 80 milligrams, my name, and the date, 1/30/2020. I'm going to label my medicine. Now I'm going to prime my tubing. tubing is primed. Okay, now I'm going to gather my stains and head to the room. Hello, my name is McKenna Devers and I'm a nurse from MCC. I'm going to be your nurse today. Can you tell me your name and date of birth? Do you have any allergies? Okay, today I have for you gentamicin 80 milligrams. It's going to run through your IV line and it is for your infection. It's going to make you feel better. Now, I'm going to lower this and check for blood return. We have blood return, so it's patent. And while I'm doing that, I'm going to lower this. Wash my hands. We're going to use the port closest to the pole or the bag. I'm going to clean for 30 seconds. Before I connect this, see, it's been 30 seconds. I'm going to assess the site. There's no redness or edema or infiltration at the site. Do you have any pain at the site? No? Okay. Now I'm going to connect. Okay. Now, we're going to give this 8 drops per minute or 50 milliliters per hour over 30 to 60 minutes. So I'm going to use this clamp. I'm going to unclamp this and use my clamp here. And we're going to get 8 drops per minute. That's too fast. So we're going to get 2 drops in 15 seconds. One. Let's start counting now. 2 drops. One. 2. That's too fast. Now we're going to start counting now. 1. 2. 3. 4. No, that's too slow. 'Count for 1. That's too slow, so now we're going to count again. 1, 2, that's 2 and 15. 3. 4. Okay, now we're going to count 1, 2 and 15. 3. 4 and 30. 5. Not 5 yet. 5. 6. 7. 8. In a minute. Now we got that right. Ma'am, are you comfortable? Do you have any kind of pain or tingling feelings or anything like that? No, you're okay? Alright. Well, now it's time to take it down. So I'm going to clamp this. Lower this back up. And set it back to its normal rate. Set it back to its normal rate. Okay. Do you need anything? Are you comfortable? Okay. Here's your call bell. Please let me know if you need anything. Thank you.